This is a presentation to staff on postoperative pain management that is part of an assignment for Essentials of Nursing Research final assignment. We'll be talking about postoperative pain management and research methods and the approach to change with the postoperative pain management. The development of a PICO question for this subject was developed with the patient population of 65 years and older, with an intervention of pain management with scheduled non-narcotic medications, comparing it to difficulty determining administration of pain medication with narcotic pain medications due to confusion, decreased mentation, or possible anesthesia complications. The outcome is to have an improvement of the patient and compliance with treatment and pain control. And this would be during the first 48 hours following surgery. So we're looking at the postoperative pain management, the model for evidence-based practice, which is a 6-step process, which the first step is to identify an opportunity for improvement. In our case, it's management of post-op patients 65 years and older, first 48 hours after surgery. Form a group to address current practice and request participation from staff. Collect internal and external data. Internally would be compile reports of statistics from the facility for 2 years, and do research on current data and resources through the library or the website or the internet. Develop recommendations and formulate a plan for change, and request feedback from staff, perhaps doing a trial period for 90 days and then review the data for effectiveness. There are 2 types of data that can be collected. The first is quantitative research, which is numerical data that's used. In this case, we'd be observing patients that are 65 years and older that have had surgery. They're going to be monitored postoperatively for complications of vital signs, mentation, pain management, bowel habits, urinary retention, and appetite, and whether or not they have nausea or vomiting following anesthesia, participation in post-op treatment such as physical therapy, and whether they have family members that are present. It's a cohort study was done by Caponetro, and Silva that stated that there was a 20% complication rate of patients that are older than 65 years of age that have surgery. I did a sample study of 4 patients that were observed through direct patient care. They were all patients that sustained a hip fracture as a result of a ground level fall. One 92-year-old patient did not have any complications before or after surgery. A second 92-year-old patient had major complications of post-op delirium, and all symptoms that were being observed, or signs that were being observed for, she had an issue with. She was not able to participate in physical therapy until day 5, and her hospital stay was extended to 7 days. We had a 76-year-old male that had minimal complications as a result of urinary retention, but once he had a straight cath placed and urine was drained at 560 milliliters, he began to urinate on his own and had no further problems. Additionally, there was one 98-year-old female that was evaluated by the surgeon and deemed to not be a surgical candidate because she had an underlying health history and of her advanced age. The palliative care team became involved, and she was transitioned to hospice care and discharged home. So 1 patient had no complication, 1 patient had minimal complication, and 2 patients presented with increased complications. The qualitative data is results that can be obtained from an external review, such as resources and journals. The resource that I gained information from was from an article that was completed by Chatchumbi, Navangpram, Erickson, and Manzahin, which was a study conducted in Thailand of 20 nurses that worked on a surgical unit. 69 patients were identified in the study, and there were 3 areas that were identified over a 5-week period that resulted in a better understanding of pain management and a challenge to increase the current guidelines of care. And that was engagement and conversation, which resulted in a trusting nurse-to-patient relationship, the availability of narcotic versus non-narcotic methods of pain management during the first 24 to 48 hours in regular intervals, And then the nurses felt that they had difficulty maintaining balance with patient needs and their nurse duties with documentation. So they felt like they were providing a lack of appropriate care. So the model for evidence-based change, one of the steps is recommendation. So in this case, there's an emphasis on pain management education with the patient and family members in the preoperative setting of what to expect following surgery with pain management. And then there's the use of non-narcotic pain management such as Tylenol and Toradol around the clock scheduled that has been shown to provide superior pain relief. And then use of a combination of no medicine techniques in conjunction with pain management. So the evaluation for change is an approach to problem solving that's focused on clinical evidence from studies, clinical expertise, and patient preference. It's challenging but necessary to increase the knowledge and skill deficit in maintaining a high standard of nursing care. A revised practice guideline based on recommendations is developed based on study results, which is part of the process to integrate and maintain change in practice. Progress is monitored of the changes moving forward. Results are then shared with administrative leaders for approval and adoption of the new standard of care. And then once that's done, then an in-service is scheduled and provided for all staff involved. It's a valuable tool for nurses to identify the need for change to maintain a high quality of patient care, as well as increasing their knowledge and expertise. We're going to look at Cotter and Cohen's model of change, which is an 8-step process. The first step is the identity of a problem that's been a standard of care and may have been in place for a really long time, but there has been some issues that have risen over a short period of time. So it's being looked at. In this case, it would be effective pain management for post-op patients. Then a committee is formed of knowledgeable and experienced nurses that are committed to stay involved in the process. An example of something that they could look at would be to research options to enhance the patient experience in the management of postoperative pain management. Once a committee's been formed, it's essential for members to each have the same vision, work toward developing goals for change, and then stay committed for at least, say, a year, for example. Then they would be charged with obtaining information on the guidelines of care, existing standards, and then, this can be done internally, externally, and then consider changes, such as following a scheduled non-narcotic pain management round the clock instead of an as-needed schedule of narcotic medications. Once the vision of the committee has formulated change, it's necessary to communicate these ideas to staff. An example of this would be to recommend that a post-op patient receive non-narcotic pain management on a scheduled regimen for the first 48 hours, every 4 to 6 hours to achieve pain control. Also, it would be known that a stronger medication such as oxycodone would be available to administer on a PRN basis for breakthrough pain if needed. In order for change to occur, staff need to be empowered. The more knowledge they have, the better they're going to be prepared for it. It's important to identify and remove barriers, such as a lack of resources or a skill deficit, that can cause frustration and affect changes. It's important to establish short-term goals. In doing this, staff are better able to adapt to proposed changes a little at a time. Too much information at once can lead to delays in change. To conquer change, it's important to be persistent and set manageable goals. It's important to nourish change so that it's lasting. Once change has been initiated, it's imperative to encourage staff during the process. Cotter and Cohen emphasize that team leaders need to have a strong voice and share their vision for change to staff that fosters motivation and enthusiasm in the identity and solution of an issue that needs to be changed. It results in new behaviors that replace old habits. This is my presentation. It's been a pleasure to be in this class, and I learned a lot.